Hi, welcome back to Senior Savvy Cannabis. This is Catherine Goldberg. I'll be your host. Today, we have a treat for you. We're joined by Dr. Aaron Killion out of Arizona. I am very excited for our conversation, Dr. Killion. I think you're helping a lot of people, and I'm curious to kind of get into the weeds of how that process works. So, thank you for taking time out of your busy day to join us. And it's a pleasure to have you.
Glad to be here. Thank you.
Thank you. So why don't so tell us a little bit about what you do, what kinds of patients you see, and then what your cannabis philosophy is when it comes to wellness.
Okay. What do? I work at Greenleaf Medical Marijuana Clinic. We offer medical marijuana certifications for patients just in the state of Arizona. I am one of the two staff physicians there. And uh, as a doctor, it is my job to evaluate patients to make sure that they qualify for the medical marijuana program or for the certification in Arizona. It is fairly broad what qualifies patients, but you still have to qualify. And from that point, I basically meet with the patients, make sure that they will safely be able to use the medication or the cannabis product, and make sure they don't have any questions. There's a little bit more we can get into of what goes into it, but really my job is I'm actually technically a doctor in a way for the state of Arizona. I am not the primary care provider for the patients that come to the clinic. They come in, we meet with them one time, and then we follow up with them in 2 years if they want to recertify. But it's a fairly simple process, but there's a lot of opportunity in there to really help patients and give them more information.
I love it. Is it just to clarify, does Arizona have a medical program and a adult use program, or is it just medical?
There's medical and recreational. And
Okay. So
recreational use gets to purchase the same products, but they can purchase much less quantity and much less potency. And when you get into I guess you could say the medical realm or the needs of patients with actual pathologies or diagnoses, they do really need the medical grade products or the higher potencies to meet their needs from a medical standpoint.
can you say more about that? Just because I launched this blog and podcast about 40 days ago. So I've been focusing really on kind of the lighter doses. Everything has a preface of, but first try CBD because people need to get their feet wet. Um, this is a cool statement because you're saying that a certain kind of patient may actually need a higher dose cannabis product. Can you say more about maybe what that pathology might be or how that patient could get to that point and how the relief is helping in their life? Because, not to ask a really long question, but after you've been using cannabis for a period of time, you build up a tolerance. So the high that a new person might be feeling when they smoke a joint may not provide the same effect to someone who's been smoking a joint for 3 decades.
That's
So
correct.
I think that may be the direction we're going in. So I'll stop talking now.
It's very much the case, what you just said. So there's a lot of considerations. One, what are the medical needs of the patient, and is that need being met by the medication? That's one of the basic questions I ask any patient, even for non-medical marijuana patients, for other patients that I see, is the medication meeting your needs? Are your symptoms in control? Are you feeling better? Do you feel confident in the medicine when you use it? And you just talk to them and say, is it meeting your needs? But in general, the lower or the recreational amount of marijuana that you can buy is, I think, capped at 10 milligrams per unit. And you can buy, I'm going by gummies, just the gummies would be 10 milligrams per unit, and you can buy 10 units. And I believe you can buy 20 total, but they can only come in packages of 10. And that costs a certain amount. You have a certain amount of taxes. But if you're in pain or have a chronic condition that requires 50 milligrams per day, you bought 4 days worth of medicine and you have to go back to the dispensary 2 times a week now. And that's just completely unmanageable for some patients. it's not feasible for them to go wait in line. It's a long drive for a lot of people, especially if they don't live in the city, or what if they have to get it mailed to them? So the medical program allows patients, I believe you can get up to 100 milligrams per unit, and you can buy 10 units, and you can buy multiple baggies of 10 with the medical marijuana program. Now they do cap you at a certain limit, but I think it's very difficult to reach that. I don't actually have a card myself because I'm a doctor. I usually like to make sure that I don't have to worry about if I get called in front of the board where you have clear mind and all that, just like a police officer in the way, but I could if I wanted to. But and again, I don't know the exact amount that is allowed by the state of Arizona, but you do get a online tracking system. So when you go to the dispensary, they tell you like how much more do you have on your monthly quota or whatever, or how much can you get. But so back to your question, it really depends on the patient of what is their needs, and the medical marijuana program allows them a range of dosages that will allow them to meet their needs, where recreational just does not come close to that in any way. I've seen patients who are up to 100 milligrams per day, and that puts it in perspective. If you go recreational route, you're buying one whole bag of 10 gummies, and that's your 1 day use in 10 gummies, and you can get that in one little gummy as an alternative. So that's what the program looks like in Arizona.
I love it. It's fascinating that every state does this differently. But it's nice to hear when some states seem to do it in a very efficient way. Because that probably helps get more people into the system, and to be able to be helped by this. I have a couple follow-up questions because this is so interesting. Um, have any other doctors that you've talked to ever like given you a weird look about your cannabis, your prescribing can like, has there ever been like a weird older doctor that like called you a drug dealer? What's been the response from the medical community in your personal community?
Neutral, I would say. I've never felt hostility from another healthcare provider. And I think within the healthcare community, there's a general professional friendliness that goes with everything. I've never felt put down or anything or questioned about why I do that. You said another thing that made me want to follow up with that, but I'm kind of blanking right now. It was the general tone of other doctors, right?
Exactly.
Um, a lot of patients come in and say that their doctors are not allowed to prescribe them. Oh, and that's another thing. In Arizona, technically, it is not a prescription. So I have gone over this with my malpractice insurance company, and they're always saying, "Well, you can't prescribe medical marijuana. It's a federally controlled Schedule One substance, and you have to get." I just show them the legal rules in Arizona is doctors do not prescribe marijuana, medical marijuana. We certify that the patient is able to safely use it for an acceptable condition, as kind of laid out by the state or the voters, if you want to go by that, of what the voters have decided is an acceptable use for medical marijuana. So in Arizona, at least, doctors are not allowed to prescribe it. And again, you don't go to a pharmacy to pick up your medication. You go to a state licensed dispensary as well. Um, but that said, is sometimes if I want to smooth things over, I'll say I work at a pain clinic sometimes. Um, so yeah, I think there's still a stigma within the medical community where we maybe hide that a little bit, but no, to answer your question, there's been no overt hostility or anything like that.
Good. I feel like doctors just want to help. So, any way that can happen is moving the bar forward. Can you tell me a little bit about like the range? Sorry, you like said something funny and then I choked. It's because people are listening. That's fine. Okay. Laughter and cannabis. It's the magic combination.
Yep.
Okay. Can you tell me a little bit about the range of patients who you see throughout the day? Is it like 18 to 108, or like and then are there any patients who like over the course of your practice have like stuck out for any particular reason?
Everyone uses medical marijuana. I have seen every single, I guess you could categorize people by age, race, ethnicity, religion, occupation, former occupation. Nothing surprises me. We have former police officers, current firemen, mailmen, teachers, barbers, everyone, you name it. A lot of general contractors, people who work in the trades. So that's construction, but electricians, pipe fitters, it's everyone. We even get former opiate addicts who are aware of their limits with what medication they can use, and they have suffered from opiate addiction in the past, and they still have medical needs, and medical marijuana is a great fit for them. So all age ranges I have seen, I was trying to count it up yesterday. I've probably seen maybe 3 to 4 thousand patients in the last 18 months, I think. I think
Are you
so.
serious?
I think so. Yeah, I mean, if I even go by an average of, say, 10 patients per day, some days it's 20, 25, some days it's less. But if I just go by an average of 10 patients a day, 5 days a week, I think that puts me over 3,000 right there. And that's just in a year. Um,
That's incredible.
it's a lot of patients. And it's an extremely broad spectrum of who is accepting of medical marijuana as a viable treatment. So yeah, it's everyone.
Are there any patients who come to you and say, like, I could never have seen myself in this position asking for medical marijuana?
Oh yeah, yeah. A lot of people, not a lot. The first timers, I guess, the people who have used it recreationally, in college or whatever, they are a little tepid about it, maybe a little nervous. They feel like they're doing something wrong. So that's really easy. I just tell them, you're not doing anything wrong by coming here. You are perfectly within your rights within the state of Arizona to see if this is a viable medical treatment for you. And I am here to facilitate that and answer all your questions and make sure that you feel safe using it. Yeah, some people a little nervous. I think they feel like they're doing something wrong, or they almost have that look on their face like no one stopped me when I walked in the door. No one stopped me when I gave my name. Like they're just waiting for the yank to pull them out of the doctor visit, but it never happens. And then when you say, "Okay, you're done, you're certified," they just look at you like, "What? That's it? There's nothing else? I don't have to, you know,
Like
you know,
strip down and
and
yeah.
do crazy things to prove that I'm in pain or something." So people are often more shocked that it's as straightforward a process now as they expected it to be.
That's amazing. Um, Amazing. What what do you think is the biggest driver of cannabis acceptance? Not necessarily just in Arizona, but we could start with just in Arizona. Like you've seen, let's say 3,000 people, right? If those 3,000 people have one friend that notices the relief that that patient has experienced, that that can really create a really big ripple effect. So I like to ask people on this podcast sort of like, where do you think the cannabis conversations are happening that are getting people, that degree of people to come in?
I would say a lot of things drive it, without having read any studies or being a sociologist or anything. I think you generally see a decreased rigidness or kind of conservative nature, not politically conservative, but maybe socially conservative idea of, oh, cannabis was bad 50 years ago because we were told it was bad, but now it's clearly not. And people, it's just obvious on the face of it. Everyone has probably had experience with someone or personal experience with medical marijuana or just marijuana recreational, and they figured it out for themselves. It's just as, harmless as having a glass of beer with dinner or a glass of wine. It's not going to make you do all the crazy hysterical things that we were told maybe 50, 60 years ago. Like if you smoke pot once, you're going to end up in jail for the rest of your life because you did something that you would never do otherwise. I think that a lot of people have just come around and sort of relaxed their opinions on it and are a little more open-minded. And I think well, I'm not sure if I should go here, but I think I have also met a lot of people that are dissatisfied with their treatment under the current medical system and have seen that they have the opportunity to go their own way and manage their own condition themselves or do it with their input and a doctor's input. I guess you can't see my hands, but the, in a lot of ways, the acceptance comes from people realizing that they have autonomy in their own healthcare and they are not simply required to do what their doctor says and only what their doctor says. That's
I
actually a very
hit the
common
nail
thing.
on the head with that.
Yeah.
Sorry, I cut you off.
No, yeah, it was just a lot of ways lead to social acceptance. I think it's just a lot of little things all at once just kind of give people the idea that it is not what you were told.
I I think you're absolutely right. And I think the point that resonated most is that, and it's not like a respect issue in the slightest. It's that something has changed between like when my parents were my age and me when I go to the doctor, that the doctor used to be the only one who knew. But anyone who loves medicine or science or whatever can know a lot of things.
Mhm.
And you can start to take control of your own health. You can ask questions, you can explore different possibilities. And the fact that so many people are so dissatisfied with the prescriptions they take,
Oh yeah.
like you take a third of the people who take whatever given prescription, a third of them basically are like, it doesn't work good enough. Like
Mhm.
it doesn't solve the problem. And if a plant-based medicine could tip it over the edge in addition to whatever regimens they're following, like I think that's why it's really taking off, that people are like, okay, it's a lot of different things have to come together at the right time. And it's not like, we hear a lot about how like cannabis will solve everything, and it won't solve everything, but it will, I think, allow things to fall into place naturally and with a little bit more ease. um,
Mhm.
so very interesting. I like the Arizona program. This is good. I'm learning from like state to state like what everyone is doing, and this seems easy. So wait, so do you see people primarily through telehealth?
In person and a little telehealth.
Okay, like
Our
50.
clinic has the option for both.
Okay. Is it like a 50-50 split? Is it like more?
It varies, but yeah, 50-50 is a
Okay.
good way
Okay.
to.
Okay. Our first guest was also a fabulous doctor who does telehealth. I think she also brought up the really interesting point is that like it, the video creates a little bit of like a distance where when you might not necessarily feel comfortable talking with a doctor in your community about this, you do feel comfortable talking with a doctor online about it. So changing those dynamics to let the patient be a bit more comfortable, I
Mhm.
think kind of goes a long way. Um,
We've had really positive feedback about the telehealth program, especially the patients who have difficulty with mobility or don't have a ride to our place. Sometimes they just can't get someone to get them physically to a certain location at times. So the telehealth or virtual platform is extremely good for them, and it serves a lot of benefits as far as just, if you think about it, like if they don't have access to healthcare, they can't get it. So you bring the access to them in a way. And, our clinic has a very simple telehealth program or a way to get patients on video, and 999 out of 1,000 have no problems with it. Every now and then there's some technical difficulties, but for the most part, it's extremely easy. And, I have staff that talk to the patients and get them on the call and talk to them on the phone and tell them push this button, push this button. Okay, this button that looks like a little camera, push that. But we get them there, and overall, a lot of people, I think they feel more comfortable talking by video now. I don't know where that shift happened, but here we are.
Yeah, maybe like coming out of the pandemic, people were kind of just like, well, this is really convenient. Like, I don't
Mhm.
have to schlep many,
Yep.
many miles away to sit in a cold office. Not that your office is not cozy or anything, but just, um, this is very interesting. I really appreciate just like the wide variety of patients you're able to help. That it's not limited to like the traditional ailments that we hear about, like Parkinson's and depression and whatnot. But like, can you actually say a little bit more about the opioid recovery initiatives? Because that seems like I don't want to say this as a quote or a fact or anything, but I feel like I remember hearing something about that there's a high success rate with previous opioid addicts shifting to a medical marijuana treatment once they detox and obviously go through different therapies. Is that what you've noticed? Is there any like tracking going on with that?
As far as how successful people are at staying of abstaining from opiates after they've gone through the addiction and recovery process.
Yeah, and not in like a technical by the book form, but generally speaking, is it a more successful treatment than just maybe doing like a Narcotics Anonymous type program?
Well, so when I'm talking to patients, so in Arizona, you are not allowed to be certified for opiate or past opiate addiction. There is, I can read to you what actually is a qualifying condition. It's somewhat limited, but all in a way not. But my experience of talking to patients is, I will talk to them and sometimes they just offer information unprompted. Which to me, it happens so often. I always wonder, like, why are they telling me this? I didn't ask them. And they just want to tell me how effective medical marijuana is for them. But they'll say, I've tried the opiates, I've been addicted, I've gone through it. They open up about their past a little bit of what happened when they used the in a bad medicine, I guess is a bad word, but ineffective medicine for pain control, if you want to be technical. It led to really negative outcomes for them. And they will tell me that medical marijuana really does help them control the pain and prevents them from relapsing or just living in chronic pain, knowing that they can't use opiates or really relying on really high doses of just over-the-counter pain meds like Tylenol, ibuprofen, Advil, all that stuff, which really, I mean, you should not use that chronically. 2 weeks max is how long those medications should be used. They're very effective short term, long term, they're a disaster for your health. That's where it's really nice to see people using medical marijuana for chronic pain. But to kind of round about that answer is I am not evaluating patients whether medical marijuana would be appropriate for them because of a past opiate addiction. I only hear about it not second, firsthand from the patient, but not as a direct answer or not from a direct question for me as part of the certification process.
I understand.
So,
And
but I see it every day. People always tell me that they struggled with opiate use in the past, or really some people will use it and have told me that they have used it and they stopped using it willingly because they've said, I know I'm getting addicted to it, or I know I'm becoming reliant on it. And actually they stop filling the prescription on their own before they go too far. So that's very common as well. I do ask patients that they put their current medical treatments, especially the prescriptions that they're using, on their intake form, and I do see a lot of the opiate use or non-narcotic opiates, so like gabapentin, trazodone, some very strong painkillers that don't really lead to dependency, but are still very strong.
absolutely. Very interesting. And just besides the opioids that are dangerous on their own, what about the benzos? What about Xanax? Because I remember Xanax used to be a big problem too. Is it, or is anyone switching to medical marijuana instead of using like the high addiction risk anti-anxiety treatments?
I don't think so. I know benzodiazepines get a bad rap, but I have seen their benefit as well if they're used safely. A lot of times people have trouble sleeping, and this is one thing I differ on people. I'm not convinced that medical marijuana leads to better sleep. I think it allows people who are in pain, especially, to go to sleep, but I'm not sure if people are just having sleep problems that medical marijuana is ideal for them. And that technically is not a qualifying condition, so I don't really have to worry about that. But no, I haven't seen people choosing medical marijuana as an alternative to benzodiazepines,
Cool. Okay.
which is Xanax. I know I've prescribed certain, I like another one called Restoril or Temazepam, which is a very short half-life and is much better for sleeping than like Xanax. That's more of an anxiolytic. So I've seen the benefits, and I certainly understand why people need to get to sleep sometimes.
I appreciate that. You seem like a very holistic doctor where you'll take what works.
Yeah.
Um, so thank you for this. I feel like we're running on out of time because I have free Zoom. So let's end on, is there anything that you'd like people to know about medical marijuana, or possibly just to for an idea to germinate in the back of their head so that maybe one day they'll come around to it?
I would say in the state of Arizona, at least, or wherever it's legal medically, is you are not doing anything wrong for advocating for your health and looking for a medical treatment that might help you. And if you want to try medical marijuana, you are not in any way a bad person, a bad patient, an irresponsible person for trying to find relief for symptoms or disease by trying medical marijuana. Yeah, it doesn't happen as much, or maybe I don't notice it as much anymore. But when I first started seeing patients at Greenleaf, it seemed like it was everyone who came in and just felt guilty about being there, like they were doing something wrong. And I take their sometimes blood pressure, but a lot of times like heart rate, and do a quick physical exam, and you can always tell. Some people, I'll put the heart rate monitor on their finger, and I'll just look at it, and it'll be like 110, 120. And I'm just like, are you okay? Are you nervous? And they'll be like, yeah, I'm nervous. Like, I don't know. Am I doing something wrong? Like, am I going to qualify? And it's just, you don't have to worry about that. As long as you meet the certification or the qualifications from the state of Arizona to be certified, you are acting in accordance with the law. You are not doing anything wrong. No one is going to bother you. So I would just say, start there, is you're not doing anything wrong by asking for this type of treatment.
I love it. I love it. And you're right. By removing the shame and the guilt, um, that's really going to move it forward. And we've seen it throughout generations, and obviously people my age have no guilt going to the cannabis store. So that's a very insightful thing to notice. I appreciate that. So thank you so much, Dr. Aaron Killion. And we will link to everything so that our viewers and blog readers, if they live in Arizona, can maybe perhaps telehealth and meet with you
Of
and
course.
get their card, and just start taking control of their own health, because I think that's what it really comes down to.
Yeah, that's right.
Awesome. Well, thank you so much for your time and for your insight and wisdom. I appreciate it.
All right, you're welcome. It was nice chatting with you.
You too.